I want to introduce the panel that will be talking about the government response to COVID-19 and issues related to the emergency provisions. We first have as the chair, Morris Fiorina, who's the Wendt Family Professor of Political Science at Stanford and the Hoover Institution Senior Fellow. And the panelists are Niall Ferguson, who's the Miliband Family Senior Fellow at the Hoover Institution, and Neal Woodbury, who, among other things, is the Chief Science and Technology Officer of Knowledge Enterprise at Arizona State. So Mo, take it away.
Okay, thank you, Bruce, and welcome back, everyone. Before I turn it over to the other two panelists, I just wanted to say a few things about the Emergency Powers project that is currently underway with Hoover, the Lane Center, and other elements of Stanford and NYU. With the support of the Lane Center, we've been constructing a database of emergency powers. We have a team of students combing through the state constitutions and statute books, compiling what the powers are and all manner of characteristics about them. Hoover and senior scholars, Stanford scholars, are taking a look at how emergency powers have been implemented in California and elsewhere. And with the support of the NYU Brennan Center, we're also tracking all the court cases that have arisen from the exercise of state emergency powers. This is all work in progress. Maybe later I'll be able to talk about this. But right now I want to turn it over to our two panelists, cede my time to them. Niall Ferguson, as Bruce said, is the Miliband Family Senior Fellow at Hoover, the Senior Fellow at the Center for European Studies at Harvard, and a visiting professor at various institutions around the world. He is a historian by training, and he'll be talking today about the Spanish flu post-World War I epidemic. And I'm told that Neal is a bit of a contrarian, so I look forward to his take on this. Our second panelist is Neal Woodbury, formerly director of the School of Molecular Science at Arizona State University. Has a very long title now, Interim Executive Vice President, Chief Science and Technology Officer. My friend, the Dean at Arizona State, tells me that basically Neal is the czar of all things COVID related at Arizona State, and in his spare time is also advising the state government. Each of them will speak for 10 to 12 minutes, and then we'll take comments from the audience. So first, Niall Ferguson.
What I'm going to try and do is put a historian's hat on and think about what we've experienced in the past year, and specifically the government response, saying a little bit about ways in which the Western states have distinguished themselves from the rest of the United States. I'm going to try and show some slides to do this, so bear with me while I get that to start. This is also an opportunity for me to share the jacket of my forthcoming book. Is that displaying all right for you, Mo?
Yes.
The book Doom, which will come out in early May, is really an attempt to set this particular disaster in a broader historical context. It's a general history of disaster of all kinds, and not just pandemics. There are already books that do that. The attempt here is to ask, what can we learn from disasters in general? And one of the key takeaways is that really there's no such thing as a natural disaster as opposed to a man-made disaster. All disasters, whether they're earthquakes, wildfires, pandemics, financial crises, or wars, have some political dimension. Ultimately, an eruption of a volcano on an uninhabited island is very different from an eruption of a volcano on a densely populated part of Italy. We choose where we build our cities. So the argument of the book is, and I'll try and reflect it in what I'm going to say, that one can't really understand disaster as something that does not have some political dimension. One of the things that I remember pointing out a year ago when I first started commenting and writing about what wasn't then called COVID-19 was that there was going to be a pandemic and it would likely come in waves. And that was just based on historical observation. Not only that, but it would be of a duration greater than a year. So when, if you remember back in the spring, people talked about a single curve that just had to be flattened, that was sort of pop epidemiology of the sort one saw in the papers, that was historically ill-informed, because almost all pandemics, going all the way back to the earliest times, come in waves and take more than a year, often much more than a year, to play out. It was also obvious, again on the basis of past experience, that a pandemic would vary widely in its geographical impact. And you can see here, if you just rank US states by deaths per million of population, there's enormous variance from New Jersey at one extreme to Vermont at the other. When we look at our present predicament, it's fairly clear that we are in the third wave of the American COVID epidemic. And at least by some measures, the third wave is the biggest of them all. But again, the geographical distribution has varied. This is much more a Western phenomenon than the first wave, which was heavily concentrated in New York and neighboring states. Even if one zooms in on a particular state, you realize that there's a kind of fractal quality to this story. When we look at California data, we're actually looking to a large extent at data for Los Angeles County. And again, you can see this remarkable third wave. Actually, California didn't really have a first wave. It was part of the summer ripple, but it's had an absolutely huge third wave, again, concentrated heavily in Los Angeles. So far, the best that one can say is that this third wave is not the worst in terms of excess mortality, at least not yet. I'll come back to whether it could be. The reason that I thought this way can be fairly easily summed up in these charts. The first shows you the trajectory of the so-called Spanish influenza of 1918-19, and the other, the 1957-58 Asian influenza, which is largely forgotten today, but in fact bears a much closer resemblance to what we've been through in the past year than what happened in 1918-19. But you can see the wave pattern here, and notice that the second wave was really much worse than the first wave in 1918-19 in the United States. To try to get a sense of the orders of magnitude, it's useful just to compare these two events and then make some appropriate adjustments for changes in population. What's immediately clear is that this was not and was never likely actually to be 1918-19, which was really one of the worst pandemics in all of history, matched only by a very few events like the catastrophic Black Death of the 1340s in Europe. The infection fatality rate was certainly much higher than the IFR for COVID-19, somewhere between 1.8 and 2.2%. And if you make appropriate adjustments, you'd be looking at 160 million deaths globally, and maybe 2.2 or thereabouts million in the US. I mention this because the other Niall Ferguson, the one at Imperial College London, who spells his name Neil, had a big influence on Western, and I say Western meaning European and North American policy, back in March when he published a paper suggesting that if drastic steps were not taken, then up to 2.2 million Americans would die in this pandemic. And what not many people noticed was that that implied we were facing 1918-19. Actually, and I've argued this in a paper I presented last year at a Hoover seminar, which will appear as part of the book, we're really closer to the 1957-58 influenza pandemic in terms of the magnitude of the shock, in terms of mortality, in terms of infection fatality rate. It's probably worse. That is to say, the COVID-19 IFR is probably higher than the IFR for the H2N2 in 1957-58. But, and this is a key point, the influenza of 1957-58 did not discriminate against the elderly. In fact, a great many younger people were affected by that influenza. It killed the very young as well as the very old, and it actually had quite a significant impact on the teenage population in the United States. So in terms of quality adjusted life years, I think 1957-58 will remain actually a worse pandemic than this distinctively ageist one that we've experienced. So, I mean, that's the kind of broad historical perspective that I think one needs to bear in mind. Here's the point about the age profile of victims. It's extraordinarily unusual historically to have a pandemic that discriminates against the elderly and leaves the very young alone. In fact, I don't really think I know of another case quite like this. And we should be very thankful for that, because our experience over the past 12 months would have been far, far more harrowing if it had been very young children who were dying at the same rates as very elderly people, which was the case in 57-58. But as already has been observed, the economic cost of COVID-19 will have been much greater when it's over than the economic impact of these previous disasters. And that's a kind of paradox that we have to, I think, reflect on. A recent Cutler Summers paper tries to ballpark total costs, attaching some dollar numbers to premature death, health impairment, and so forth, and comes up with a total cost of 90% of GDP, far higher than the contraction in GDP that we saw last year. And you might well ask, well, why has this pandemic, which was not as deadly as the 1918-19 pandemic, nor even as deadly actually as 57-58, why has it had a far bigger impact? Because you would not find 57-58 visibly in the macro data for the United States. I mean, you can look for it, but it's not there. There was almost no major economic impact. It's also very difficult to disentangle 1918-19 from the effects of the First World War, which is coming to an end, and then the post-war contraction, which seems to have been far more significant than the pandemic in terms of its impact on economic activity. This is really the point about our experience. It's not the world's worst pandemic by any means. It's not even in the top 20 in terms of its impacts on human life. But in terms of its economic impact, it really is in a league of its own and more closely resembles a war. I came across these wonderful cartoons from 1919, which imply a resemblance between World War I, the way the Germans did it at Chateau Thierry, and the Spanish flu, the way North Carolinians do it at home. A machine gun on one side and an unmasked sneeze on the other. And this is actually a quite helpful point of comparison. A number of leaders have talked about this as if it's a war, and they're not wrong, because it is in many ways, at least in terms of its economic and social impact, as big a disaster as a war. And if John Taylor's still on, I think he'll support my contention that in fiscal terms and in monetary terms, this disaster much more closely resembles a major war than actually it resembles previous pandemics. The reason why we've had such a huge economic shock is that beginning in around mid-March, governments in the Western world adopted drastic non-pharmaceutical interventions, lockdowns, colloquially, a whole bunch of restrictions, including simply confining people to their homes to try to halt the spread of the virus. The Oxford Blavatnik School has done some very useful data work here, and this chart shows the government stringency index for a selection of countries down to the end of last year. And the key point I want to make, and I don't want to go on at excessive length, is that the country with the lowest ranking in terms of stringency is actually Taiwan, the country which has had the best success in preventing its citizens contracting and dying from COVID-19. Country with the highest stringency ranking in this chart is Argentina, which certainly succeeded in imposing all kinds of restrictions on its citizens, but did not succeed in preventing the spread of the virus. The correlation that really works is between stringency index and economic shock. There's no correlation between the stringency index and success in combating the spread of the disease. And the point I want to make, really the most important point, is that even in March, it was obvious that there was a smart way of contending with the new virus. It had been adopted very quickly in Taiwan and in South Korea. And that smart way of doing it was to ramp up testing as rapidly as possible, create a system of contact tracing, and then enforceable quarantines for infected or potentially infected people. And that worked because throughout January, February, and into the middle of March, governments in the Western world basically dithered around. We didn't have the option to do that. We missed the opportunity to achieve low-cost containment. And as a result, in the end, resorted to lockdowns as a desperate measure because we'd missed the opportunity to do smart containment of the novel pathogen. You can see I picked Arizona and California. If I'd had more time, I'd have gone through all the Western states. There was considerable variation in state level measures, as you know. In fact, the variation nationwide has been absolutely enormous, much larger than that chart suggests. If you look here, and I'm afraid it's a little bit of put your glasses on kind of slide, you can see tremendous variance in the Oxford Stringency Index between states and indeed between regions of the country. And that's also true in terms of the amounts of time that states had strict lockdowns. Those varied enormously, with the Dakotas basically doing next to nothing, and New York, and interestingly also New Mexico doing a very great deal by the complex metric that the Blavatnik people devised. This stringency index captures a whole range of things, from shelter-in-place orders to school closures and so forth. But I think the key point to notice here that is exactly as in 1918-19, it was left to states to make key decisions about how far non-pharmaceutical interventions were adopted and how strictly they were enforced. And that helps explain, though it doesn't entirely explain, the different trajectories of the different states in terms of infections and hospitalizations. Here, this is a slide from the same source. You can see that actually there was a significant difference between Western states and the rest of the country when it came to school closures in the fall. I'm not going to go on at excessive length, so let me just draw my remarks to a conclusion. We aren't out of this. The next 2 months will certainly be deadly for many people. We're looking at, according to at least one projection, well over 500,000 deaths by May the 1st on more or less any plausible scenario. However, the good news is, and this is work done by my student Ike Fryman, we should by May be pretty close to herd immunity, in the sense that the effective reproduction number will be below 1, and that will be as a result of ramping up vaccination and obviously of natural infection, where people have had the disease and have recovered. So
Neil, I think you've become muted.
something terrible has happened to my presentation skills because of a rogue alert that popped up, but I'm nearly done. Let me just conclude with two observations. One is that we could yet have a fourth wave if new strains of the virus spread as rapidly in the US as one of them spread in the UK in the last month and a half or so. And that might disrupt the good news story I've just told you by perhaps weeks. But I don't think it would actually invalidate that broadly optimistic scenario that we get to the point sometime around the summer when it really does feel as if the pandemic is over. The last thing I'll say is that if we learn anything from this experience, it must be to configure our emergency responses, not just to pandemics, but to all kinds of emergencies, in the way that we saw the Taiwanese and South Koreans do it. That is to say, we must respond much more rapidly to an incipient crisis. We must be open to all kinds of possible crises because, for example, climate change is not the only disaster that we're likely to confront in the foreseeable future. And if Western democracies, including all the states of the West of the United States, can learn anything, I think they can learn from the way in which the Taiwanese authorities successfully integrated technology and the private sector into their very successful response to COVID-19. I'll leave it there.
Thank you, Neil. And now we go to Neal Woodbury.
Well, thanks. That was actually a really informative lecture. Thanks very much. And in fact, sets up things very well for some of the things I wanted to talk about. So I'm just going to talk a little bit about various things that happen. I'll mostly talk about Arizona because I've been deeply involved in what's been happening in Arizona, and a little bit about some other things, but primarily about what has happened in Arizona, and try to understand a little bit about the complexity of the decisions that have to be made in a situation like this. And I think that if you look at a state like Arizona, it's probably not different from other states in many respects, but it's extremely heterogeneous in terms of the nature of the population, the education of the population, the availability of high quality healthcare is quite different across the state. There's a lot of healthcare disparities in different places, even places in certain parts of Arizona where it's difficult to get clean water supplies and things like that, all the way to where I live in the Phoenix area, which is very, very urban in many respects and has lots of things available to it. So it's a complex environment. And when you think about a government trying to make decisions, and I'm not here to try and say whether decisions were right or wrong or up or down, but mostly just to think about what we learned about the complexities of those decisions and how one can make them. The government was very reluctant in Arizona to make decisions that would cause a problem with certain aspects of the economy, because there were a lot of people sort of on the edge in some places, and in other places also Arizona has a rather service-oriented economy in certain aspects of it. And I'm not an economist, so I'm not going to talk in any detail about that, but there were a lot of reasons why our state government were hesitant and didn't perhaps act in certain ways at certain times. The other thing is, and I think this was probably true across the nation, our Department of Health Service wasn't prepared for the scale of this thing. And we worked a lot with the ADHS, our Arizona Department of Health Service, during this. And it just wasn't ready for something of this magnitude to happen. They didn't have the parts and pieces in place to set up the testing sites that were needed, or even later the vaccination sites that were needed, and so it was complex beyond what they were used to dealing with. In the end, there were lots of parts and pieces of Arizona, including the universities, like the one I work in, which offered lots of help and set up testing labs and helped with vaccination sites and all kinds of things. And that community, I think, actually was the one really good thing that came out of this, that there was a lot of community action, and I think that will persist well beyond this. So in terms of some lessons, there were a couple of things that were interesting, and Neal referred to South Korea and to what happened in Taiwan, and this concept of community and how a community reacts to something was very important. And if I look at it from a biochemist point of view, South Korea and Taiwan had actually thought about some of the past problems ahead of time. They had dealt with some of the other coronaviruses, MERS and whatnot. They had some things in place. They understood about testing. They understood about contact tracing even before this happened. And so they were, in some sense, better prepared in that respect. Also, culturally, just very different. So, for example, in much of the US and certainly in Arizona, the concept of going out and asking the community to randomly test so you could get a sample that was statistically relevant was a very difficult thing to do. We ultimately did that at ASU because we have more control over the population, and we could randomly test and find out what was going on within our environment. And that was extremely helpful for being able to deal with the disease locally. But it wasn't the kind of information one had. One had was the sort of information that Neal talked about. You could see hospitalization and death, which is more or less absolute in the sense of what people are experiencing. But the actual number of tests and number of positive tests, well, that depends an awful lot on what people do and what they decide to do in terms of their behavior. So it's much harder to interpret going forward, and it left itself open to a lot of political interpretation, which I think was too bad in that situation. So what happened? What was sort of interesting to me, and now I'm sort of getting more and more local, within the microcosm of ASU, we were able to actually sort of study what was going on and what initiated things to change and not to change. And so, as I said, we had some tools here. We were able to measure what was going on in our student population with random sampling. We were able to do the same thing in our employee population, look at how that changed with time, what caused it to change. In Arizona, like in California, there were really the sort of two waves. There was a wave in the summer, which was a little more pronounced in Arizona, I think, than in California. And then, of course, there's a wave in the winter. What happened in the spring was much more subdued. And what we saw in all of these cases was a strong dependence on the way in which social events took place. And so most recently, with the winter one, it was very tied to the holiday season and what was going on there. One of the advantages, again, of being in a university is that we have a health app, and every day we have to say, well, we're coming to campus or not, and it also asks us if we're feeling well and various other things. So I can make correlations between people coming to campus and going to activities on campus and people not. And the activities on campus, basically people that spend a lot of time on campus were less likely to get the virus than people that were not. So it wasn't a matter of not going to class. That wasn't the problem. Classes were structured environments. We had people, sitting at appropriate distances. Everybody wore masks. Everything was structured in a way that the system worked well. The other thing that was really interesting to me was that during the school session, when people were not leaving and going home for holidays and things like that, we seemed to form a bubble. And presumably this is just students acting like students. They actually would rather not talk to people like me. They talk to each other, right? They interact with each other. And they formed a sort of student bubble. And so we found all we had to do was really be communicating properly with the students about their responsibility as a community. And when we did that effectively, and we had rules and we enforced rules about masking and the things that they were supposed to do, even the ones that didn't leave on campus, the infections rates almost invariably would go down, and they would actually reach relatively low levels. So it was, in fact, a manageable disease within that community. And that stayed true until they started running off for holidays and things like that, and started to have increased disease from normal interaction. So really a lesson learned to me was, it's not, you can do structured activities, you can have classes, you can have these kinds of things. That's fine as long as you can control the structure of what's going on. It's the normal non-structured things. People were always blaming the parties and things. It wasn't. I mean, the parties were bad in terms of when they happened. They caused some spread, but most of the spread is people sitting down and eating together. And so we ended up moving all of that outside and making it much easier for that. And that's something you can do in Arizona, something you can do in California. You can have many more outside activities and things like that. And that worked pretty well within our community. So those were the sort of things that I think really hit me in studying what was happening within our population. This concept of being able to get a group of people that cared about each other and giving them a very simple set of rules and saying, this is how you deal with it, that actually works really well. And I think going back to some of the Asian cultures, I happen to be married to an Asian wife, so I've been involved in Asian cultures a lot. And there is sort of inherently in a lot of those cultures a lot more responsiveness to the idea of the group and being willing to work together as a group. And so that may well be part of the reason why things went in the way they did. So to sort of summarize that up, a couple of different things. One is that at least within communities, I think it is a manageable situation, and it's manageable through structure. So we can do classes, we can have students learning, we can do those sorts of things. We just have to structure the interaction by which it happens. And we have to deal with the fact that we're going to have to keep people from having the same level of non-structured interactions that they've had previously if you want to use these non-pharmaceutical approaches to keeping things in check. So I think I'll stop there and happy to take any questions.
Thank you, Neal. I'll wait for the people behind the scenes to channel me any questions here. One question, so I just want to be clear. Neal, Arizona State is having in-person classes.
Yes. Mm-hmm.
I see. That's only a dream for us here at Stanford. What do we have? One interesting question, and I suppose this should be Neal Woodbury being a biochemist. Someone asked, can't find it here, but if the greater success of Taiwan and Korea was simply a reflection of the fact that populations had more exposure to coronaviruses in the past and had higher levels of resistance.
We don't know the answer to that question. That's a good question, whether or not past immunity has any, to other related viruses has any effect. But at the moment, at least I have not seen data relating past infection of coronaviruses to current immunity. There's been a lot of discussion about an inherent immunity, but in a lot of places that hasn't been obvious. If you look at some of the data out of Brazil, for example, in some of the cities where there was an extremely high level of infection, it really doesn't appear that there was a lot of background immunity in the situation. But whether there was in places like that, I have not seen data to that effect.
Okay, thank you. Niall Ferguson, Ken Cottrell wants to know if you could have your charts. You want to just tell him to buy the book, or what do you?
Actually, none of the charts are in the book in the case of that presentation, or at least maybe only one or two of them. I'm happy to make the charts available to this group. I'm sure we've got an email list somewhere that I can send it to. I think that last question's a really interesting one, because obviously when one looked at the very different approaches being taken in East Asia, particularly in Japan, which was not actually especially quick to follow the Taiwanese or South Korean example, and yet had a much lower death toll than in any Western country. That was surprising. And Japan, of course, has the most elderly population in the world, and so might have been expected to be very vulnerable to COVID-19. And a lot of research has gone into trying to explain this, and all kinds of hypotheses have been tried, like, is it the fact that Japanese had mandatory BCG vaccination? Is there some genetic explanation here? Is it exposure to past other coronaviruses? And Neal is quite right. Nobody has come up with an explanation for this that is compelling. The better explanations would seem to be that, like other East Asian societies, Japanese people adapted their behavior much more rapidly and intelligently than we did. And there's a culture of mask wearing there in flu season already. Japanese people do not hug one another and shake hands. They bow, as you all know. And it does seem at this point much more plausible that it was behavioral responses that really mattered. And it's worth adding, because we're about to probably have a discussion of stringency of state measures, that our colleague John Cochrane early on hypothesized in an excellent piece of writing that we should think about behavioral response as being more important than government regulation. He drew a model which envisaged people behaving differently in response to worsening public health data, hospitalizations and deaths. And then a paper by Austin Goolsbee proved that that was right. And that paper, which was just published in the journal this month, shows that that really changes in state regulations explained a very small proportion of what happened. And he looked in particular at the Midwest. It had much more to do with behavioral adaptation, people responding to news. And I think part of the problem that we've had in the United States is that there's been a lot of fake news to respond to, a lot of very confusing and misleading and contradictory advice about how to behave. I was in East Asia right at the beginning of the pandemic. That was not and has not been a problem in East Asian societies, where there's been a much more readily formed consensus about how to adjust your behavior to a novel pathogen.
Okay, thank you, Neal. Neal Woodbury, there's a question. Do you think your model at ASU could easily cross over to all the educational institutions in the country, or there are other differences across the states and universities that you don't think would necessarily transfer?
You know, obviously, first of all, the demographic of what you have in a university like ASU is going to be different than what you would have in other communities that aren't a college, right? I mean, you're talking about within our locality here, 75,000 students, mostly between 18 and 27 or something like that. And then of course you have the staff and the faculty. And while that sounds like it might be, in fact, I think people felt at the beginning that was going to be the unruly group. In fact, the reality is, because they interact with each other, and because there's so much, if you can deal with it in a way where you get people to recognize this is a problem, and your peers are the ones that are going to suffer if you don't behave appropriately, then in fact that group is probably much easier to work with from a management point of view than, you know, a town which has more complexity and more demographic changes and differences. I suspect that, and I know from talking to people in other universities, many other universities have also managed to manage the disease well and have similar evidence that it's not structured interactions in the universities that are causing problems. Where difficulties have happened, they've tended to happen because they didn't have a very good way of dealing with the social interactions that were going on in the universities. So we came up with this community of care concept very early and really pushed that very, very hard with our students and gave them tools to use in order to, you know, masks and sanitizers and all kinds of things. And then of course we did put in restrictions. You know, we did talk about what you could and couldn't do, and we said you had to wear them under certain conditions and all these kinds of things. But mostly trying to focus on the peer-to-peer interaction.
Thank you. We have a number of questions that ask in one form or another. People would like clear answers. Are there any real definite answers on how closely the stringency of the lockdowns relates to controlling the disease, and whether it's worth it economically? I mean, I'm melding about 7 or 8 questions here together. Whichever one of you wants to take that.
I'm happy to have a go at this. The problem is that the word lockdown covers a multitude of different non-pharmaceutical interventions. And one of the papers that came out last year that tried to kind of break down the different measures and assess their effectiveness, I thought did a good job of this, showing that just some of the measures were really stupid, like stopping people going to parks when beaches. When that was introduced in California, I realized that the state was run by mad people, and I left for Montana. Because it was already perfectly obvious from the Asian data that COVID-19 did not spread outdoors much. It spreads indoors where people are yelling or singing. So you've got to shut places like pubs. And Neal's completely right. The problem in colleges is not what happens in the classroom. It's what happens in the restaurants and bars. So when you start looking closely at lockdowns, you realize that a lot of what was done back in the spring was actually superfluous, or indeed probably counterproductive in terms of public health, locking people in their homes, preventing them from working. A whole range of different forms of economic activity really weren't likely to be conducive to super spreader events. Here, the key concept that public health officials did not understand, as far as I can see in many Western countries, was the very low dispersion factor, which is a technical term for the super spreader phenomenon, that about 20% of people do 80% of the spreading. And when you look at the research on super spreader events, it's very clear that it's the karaoke bars, it's the offices without proper ventilation, it's parties, it's cruise liners. You can specify quite exactly the worst places to be in a COVID-19 outbreak. Churches were a very bad place to be, sadly, for devout people. But a lot of what we did in the spring was absolutely not calculated to limit spread, but very well designed to cause a collapse of economic activity. So I think we had to do some of these things. I don't think the naive anti-lockdown view that you could just be pursuing herd immunity through natural infection, this was never credible to me, although some of the people making the argument had my sympathy. If you want to see what that looks like, look at what happened in the Dakotas, where they really essentially did that. I mean, they didn't really do anything much. And there was a huge surge of infections. The hospitals did get extraordinarily sort of overloaded at the worst point. And if you look at those states now, there's been a dramatic decline in case numbers, suggesting that they may actually have achieved some something like herd immunity, but the hard way. And if you'd run that program nationwide in densely populated states, I don't like to think what the consequences would have been. Dana Eyre asked a good question about effectiveness, and in the end, lockdowns were adopted in the UK, in the US, and in US states to protect the hospital system from a North Italian scenario. And indeed, the interesting thing is that in California, as far as I can see, although I'm watching this from the safety of Montana, the worst of all possible worlds was achieved with a great many restrictions on activity, but the hospital system still got overloaded. So you could use lockdowns and fail totally if they were poorly designed and poorly enforced.
I believe that brings us to the end of our scheduled session. Is that true, Bruce?
Yes, that's correct. So first of all, I want to thank all the participants in the second panel, Mo, Neal, and Neal. And I also want to again thank Dan Kessler and David Kennedy and the event team at Hoover, Betsy, Brittany, and Mike for their work in organizing today's event. I also want to thank my own Bill Lane Center, Stephanie Burbank in particular for the effort, and Marco Martinez for their effort in making it happen. Now, as I said earlier, the State of the West will have a second and third event. The second event is on wildfires. It will be hosted by David Kennedy. And the third event will be with CEPR, and it will be on economic effects, the economy, situation in economies. With that, I'll say good afternoon to everybody, and hope to see some of you for the next event on wildfires at the end of March. Thank you.